All right, so I'm gonna try to get right to it. This is for women who are, or men, because you could be trying with your partner as well. This is for people who have lupus or transplant recipients or both, like me, who may be trying to get pregnant or already pregnant, have questions about being pregnant, thinking about it, and nervous, whatever the case may be. And just a disclaimer, I'm going to be all over the place with this because I did not take notes. I was supposed to take notes, have a, I guess, how would you say it? I was supposed to write down my topics in the order I was going to go in. I did not do that. The way my life is right now is all over the place. I barely have time to do anything, as well as the courage to even make this video. This is something I have been wanting to do for a while, but I always get nervous and, you know, but here we are. I still don't have the courage, really. I just know how helpful this could be because I do know with my son, when I was pregnant with him, or before I even got pregnant with him, when the thought of pregnancy ever came up or the topic, I got really nervous because of my history with lupus as well as being a kidney transplant patient. So, yeah, I don't even know where I'm going to start with this or where I'm going to end, honestly. I'm going to try to make this as quick as possible. If this goes well, or if you have any questions, or if I get any feedback, then this can go into a series. If not, we'll start right here. If my time allows me to, I will do more. But right now, I'm just in my car before I go in the house to check on my baby and my family and just try to make this really quick. So, I am a female, as you can see, in my mid-30s. I won't say how far. And I'm pregnant. Right now, I'm currently 12 weeks. No, I'm 13 weeks pregnant. I have officially hit the second trimester. That was another reason why I waited. I wanted to make sure I was in a safe trimester, and I did genetic testing and everything. All of that came back perfect. Praise God. Everything was negative. So once I got those results, as well as made it safely into my second trimester, I said if I felt good, I would do the video. And a couple of people just told me if I'm going to do it, I just have to do it. So here we are. So basically, this was not planned. Luckily, I was already on, I guess you can say, pregnancy safe medication. If you are a transplant patient, you are on some type of immunosuppressant. When I first received my transplant, I was placed on CellCept. CellCept is not a baby safe medication, so I didn't know I was going to start off with that, but that's the first thing. If you're on CellCept and you're thinking about getting pregnant, or if you are pregnant or whatever, get off of it. You have a high chance of having a baby with birth defects or even a miscarriage if you conceive while on that medication. With my son, who's now 2 years old, I won't say he was planned, but I will say because of the age that I was reaching and the amount of time I had my transplant at the time, my doctors, my team, my transplant team, the topic of pregnancy came up. And at the time I told him I, hadn't really thought about it. It wasn't, in my mind to get pregnant or have a baby. So their thing was, where we're not forcing you to have a baby. If children isn't something that you want, we won't force you. However, if it's something that you think you want to do, or something that you will want to do in the future, you have to start thinking about it now. Because at the time, I think I was 5 years transplant. Most teams want you to be at least a year. Within a year, I definitely wasn't thinking about having no damn baby. Wait, when did I have my transplant? No. I was like 7 or 8 years post-transplant. But either way, at that time, my numbers were great. I hadn't had any rejection episodes. My creatinine and everything was perfect. how you doing? GFR, flow, good, function, BUN, all that stuff was good, basically. So my nephrologist team basically said, if this is what you're going to do, or you want to do it, so, or sometime you think you're going to do it, you need to think about it, and then let's come up with a plan. So me being me, I pushed it off, just whatever. And about close to a year passed, and my nephrologist, they brought it up at each appointment. I see a nephrologist every 3 to 4 months. So they brought it up at each appointment. It wasn't pressured, but the topic came up. So at about a year is when I said, okay, let's just see what happens. So that's when they switched me from CellCept to Imuron. It also, the generic name for it is a Z. It's a long name, AZIOTH. So if you hear that name, it's the same thing. So that's how I started on that medication. So it started off as in my mind, sure, just switch me and we'll see what happens. So I wasn't trying. It was just, I stopped protecting myself basically, and we'll just see what happens. And it happened faster than I thought. We made the switch, and I was told to still protect myself for, I want to say about 3 months, because they wanted to make sure that I responded well to the medication. And so we did like labs after 2 weeks of me being on it. Then we repeated labs after a month of me being on it. And then I think we did labs 1 or 2 more times, probably like a month, and then another month. It could have been just 1 more time. I don't remember exactly. But either way, we repeated the labs. They always came back fine. So at that moment, I was safe to, in their words, try. I just basically said, okay, we just won't be careful anymore. And within 2 months of not being careful, I was pregnant with my son. The pregnancy itself was a very easy pregnancy, better than what I thought. It was a lot of appointments. That was one of the things that I knew it would be, a lot of appointments, but until you experience it, it's a lot of appointments. So if you're thinking about it, get ready for that. Make sure you have a job that is very understanding, or have some type of FMLA, or have something that will give you time. If you don't have a job, good for you. At the time I did have a job. I wasn't there long enough to do FMLA, but I did have a HR team that allowed me to do special accommodations where I could, get off of work to go to all these appointments. So the pregnancy itself did really well with him. I was nervous. Numbers went perfect. Everything went perfect. You see the high-risk doctor. With him, I started seeing a high-risk doctor at 12 weeks. They wanted to, at that time, the team wanted to make sure my pregnancy was considered a viable pregnancy before me seeing the high-risk doctor. So here where I live is, my doctor had already put in a referral to see them, but they did not call me until 12 weeks to come in. So they called me like a couple weeks in advance, but the mark was right about 12 weeks that I went once, and they confirmed that my pregnancy was still viable at the time. Went in for an appointment. My regular OB is a high-risk OB. That's how he became my OB, because even before getting pregnant, by me being lupus and transplant, you're at risk for, infections, all these type of things you're at a higher risk for. So I was already seeing, and then, certain evaluations like, this may be TMI, but your PAPs and everything, how most states now are doing it every 2 years, or your insurance won't pay for every 2 years because I'm transplant. I get one every year. So I was already seeing a high risk OB, but he was honest and told me I would be his first transplant / lupus patient that got pregnant. And the same thing with my nephrologist. Even though he pushed for it, even though my team pushed for it, they were honest and said most of their patients weren't even childbearing age. So I was their first childbearing age patient. Yeah. So anyway, all those doctors teamed together. I have a main nephrologist, and I have a team of nephrologists at the local a Mayo Clinic here, and then I have a high risk OB. And then I started seeing MF, maternal fetal medicine, MFM, FMF, one of those. I started, which is a high risk OB, which is another, and well, really they're a team. So they are the ones who went over, my OB went over some risk with me, but they're the ones who went over the risk, the risk that put fear in you, the risk that make you think, what am I doing? The risk that make you leave your appointment, you know, just with all, if you're like me, in all kind of anxiety. So I say all that to say, another thing, don't do what I did was, because I was so scared my entire pregnancy because of all the risk. And I did have a you know, just experiencing loss. I had gone through a whole different topic that we may talk about later. It was hard for me to enjoy my pregnancy. I did not enjoy my pregnancy. I had a lot of anxiety and I was stressed. And I didn't tell anybody but my immediate friends and family. Sorry, somebody has my, I didn't tell anybody but my immediate friends and family. So no one knew outside of that, which is fine. I enjoyed the peace of not telling anybody about that. Yeah, I enjoyed the peace of keeping that pretty much to myself. If you were close to me, you knew, and you know, if you weren't close to me, you didn't know. I didn't, social media didn't even know until after, like a month until after he was born. Not that social media is validation, but that's just how much I kept it to myself. But it ended up being peaceful, but the real reason why I did it was because of my fear. I was so scared that I would tell the world or get too excited about my baby and then something was going to happen. Not that I'm ashamed, but you know, what if he's born with this, or what if he's born with that, or what if he's not born at all, or what if he's born, and then, you know, it's like whatever you're facing or anxiety or fear you have, pregnancy or anything, for some reason, like every little thing stand out. So I wasn't even a TikTok person, but just so happened that particular summer I'm on TikTok, and every time I turn around, somebody is talking about a stillbirth or a miscarriage. I went to my appointment at 8 weeks and it was no heartbeat. You know, it was like, where's all of a sudden this is coming from? So I had that fear. So if you are going to go into this or do this, and if you are a believer like me, trust God, put everything in his hands and pray. Whatever it's going to be, it's going to be. Your anxiety, your fears are just stealing your current joy. I did not get to enjoy my pregnancy because of that, because I let fear and anxiety steal it. So back to where I was going with that. The pregnancy itself was a very smooth pregnancy. But when you are a kidney transplant recipient, as well as lupus, sorry, I'm having work done to my house. If you are a kidney transplant recipient as well as lupus, a lupus patient, you have a high, very, very high risk of preterm labor as well as preeclampsia. Preeclampsia is high. You have your chances higher when you have lupus, and your chances higher when you have a transplant. So it's like I had it double. Yeah, I had it double. So I was told it could sneak up on you, but I think I got too relaxed because here I am going all this time. Everything's fine. The way they check preeclampsia is for your urine, your protein in your urine, as well as I'm sorry, I keep looking back, making sure you're not trying to get my attention. Protein in your urine and high blood pressure. I'm distracted. High blood pressure. So every time I went to my appointment, it was fine. I was going a lot. It was fine. I got to a point where I was literally going to the doctor every, like 3 times a week. I would see my OB once a week, and the high risk doctor, I was going to them twice a week, where they strap you up and listen to the baby heartbeat to make sure the rhythm and everything, whatever. So I started doing that at 30 weeks. Or no, I think 28. And on average, they start people at 30. I could be wrong, but I know they started me a couple of weeks earlier than what they start the average person. So like I said, up until that time, all of my appointments with my OB and my high risk doctor were, with my high risk OB and maternal fetal medicine, whatever it's called, were going great. And I will never forget, I went one Friday. Everything was perfect when I left. At this point, this is when I'm going 3 times a week. I went Tuesday, and when I went Tuesday, so I went Friday, perfect, everything left. Went back Tuesday for a follow-up. Everything was fine at the appointment, but they check your urine or whatever. As I'm walking, I was at the appointment probably about 2 hours because they did a long scan that particular appointment for whatever reason. And then I had to sit and be hooked up to the thing where they're monitoring the baby heartbeat to make sure that his rhythm is what it's supposed to be for, I think it's 30 or 45 minutes you're there for. And as I'm walking to the garage on the phone with my friend, telling her how good the appointment went, I get a call from the doctor telling me they need me to turn around. So, and I'm like, what's wrong? So they said your urine is showing 3 times the amount of protein that was just in there Friday. So basically from Friday to Tuesday, somewhere between there, my urine had developed that much protein. It was triple the amount. So it must have been a safe amount Friday. And by Tuesday, it was like, what in the hell has happened? So I'm like, okay. So I hang up with them, click back over with my friend. I'm crying. I'm telling her what they just said. And the first thing she says is they're going to deliver you. So now I'm crying worse. So I hang up with her, call my mom, telling her what happened. She's trying to come get me. The doctor called me back and said, if you promise me you're going to come back, I will let you go home to get your bag. Because mind you, I'm 33 weeks at this time. Nothing is packed. Nothing is prepared. I should have been, but like I said, I got too carried away and thinking, oh, well, preeclampsia ain't come yet. It ain't coming. Everything has been going great. So yeah, he allowed me to go home to pack me a bag. My mom came to my house, picked me up, took me to the hospital. I was admitted that Tuesday. They tried to induce me. At 33 weeks, your body, I'm not going to say you won't induce, but he was head down, but I was nowhere near ready to have a baby. So it was going to take time for my body to, I guess, dilate. Because at this time I'm upset. Now my pressure wasn't a problem in the beginning. It was just my protein in my urine. So by now this time I'm getting upset, I'm getting nervous, and my pressure is rising higher and higher. So they don't want to wait for me to dilate the 2 or 3 days it would have normally taken for me to dilate, because I was being induced at 33 weeks. I tried to stay calm, to calm my blood pressure down, but first time mom, and your baby's being born, and you're hearing, I've had all these teams of doctors who were on the same page, but when it came to delivery, they kind of weren't, because one doctor was worried about, well, let's keep the baby in as long as we can, while the other doctor's like, that's the other thing, my creatinine was beginning to rise, and the higher your creatinine rise, the lower your kidney function is. So once they saw that, now my kidney doctor's like, no, that baby can survive. Let's get that baby out of her because we need to save that kidney. So that's kind of how it was going. So one doctor's coming in and saying, oh, we're going to keep you here until you're 35 weeks. One doctor's saying, we don't have to keep her. If she promised us she'll come back every 2 days so we can just watch her. And then one doctor's like, no. And then so they all walked out, came back and said, we're just going to deliver the baby. And by the next morning, I was having a cesarean. So, so pregnancy went perfect. Birth, I can be extra sometimes, but birth was traumatic. And I think because I love my team. I really love them. I don't, but I think they were, I don't know. It was just a lot in that moment. And it's like I knew it was a possibility, but I just felt like, I don't know, it was just a lot going on. And one of my doctors said that it's not the baby, it's you. So that was something that kind of made me more upset. I don't feel like he was blaming me, but I felt like he was saying, like, you know, well, if you calm down, you might can do this, but your creatinine is going up anyway, so we gotta, you know, deliver the baby anyway. But then he explained to me he didn't mean it that way. He explained to me he meant the baby's fine, we're trying to save you because your pressure is high and your kidney is starting to say, I'm tired. So he explained to me that's what he meant. But then when he came back and said something like, I thought you would have handled this a little bit better than that because you've been through a lot. Because I've had lupus since I was 7 years old, and I had kidney problems for a while, and I finally was transplanted. So I've been through a lot over the years. But like I got tried to explain later on when I spoke to him after everything kind of calmed down after I had the baby. Yes, I get your point, but this wasn't about me. You're saying it was about me, but in my mind, this was about my baby. So I was thinking, to, you know, to hell with me. He needs to be in here as long as he wants, especially once they told me they were going to do a cesarean. When they told me that, within like 15 minutes, it was about 15 doctors from the NICU team in my face going over all these risks of a baby being born at 32 weeks and 3 days. So when they went over all those risks and they have you signing all these papers, I'm crying worse and worse and worse because I'm thinking, like, oh my God, you know. And in that moment, I feel like my nurses were, yeah, they were the best support team. And I have a very, very, very supportive family, but my son was born during COVID. So at the time, the hospital only allowed one person in there. My mom was in there for the majority of the time. And then once we got closer to saying, okay, we're going, once I was induced, then she left so his dad could come. And then, of course, his dad was there when I delivered, when we had the cesarean. So that was another thing too. I'm used to being, like I said, I've been through a lot. Always been in the hospital. My family is very supportive. My family, my friends, thank God for them. They're always there through my hospital stays. So no offense to his dad, but it was like, I need you, yes, but I need them too. So I think that was also a part of what was going on. Like, I wanted his dad, but I wanted my mom, I wanted my aunt, I wanted, you know, my best friends, the people who are normally kind of there to say it's going to be okay. I had a friend who, you know, had gone through something similar with her baby about 8 years prior. So, you know, just stuff like that. I hadn't. So yeah, that's so with him, after having, I say all that to say, after going through what I went through with him, while I was pregnant with him, I was like, oh, I can have 2 kids. This is nothing, you know, whatever. And after that birth, I just knew I didn't want to experience anything like that again. So I had made up my mind that I was done. Like, thank God for my baby. Oh, by the way, he was born, of course. He was completely healthy. He needed no oxygen. They just knew he was going to need oxygen. He didn't need anything. We only had to stay in the NICU because he was under 5 pounds. Had he not been under 5 pounds, we would have been able to go home like a regular. Like, he was completely healthy. He was so healthy that they did take him to the regular NICU, and where where you go when the babies have medical problems or need to grow more. But because he was so fine, it was just a weight issue with him, that after day 3 of being in there, when I went there because I was still admitted myself, when I was rolled up there by the nurse, they told me that they were wheeling him to a regular hospital room. So he would have a regular room that once I was discharged, I could stay in there with him, like if you stay in the hospital with your baby. So it worked out perfectly, because the day that he was, I'm not gonna cry. The day that he went into his regular room was the day that I discharged. So I never got to not be without my baby, which is another blessing, because I know people, including my best friend, who had to leave their babies in the NICU and just go and visit them. And I'm not saying I wouldn't have been able to do that, because, you know, you don't know what you can do until you have no choice. But with my baby, I was just so blessed to be able to go from literally my hospital room, and we were going at the same time. As I'm leaving my hospital room with my bags, he's coming out the NICU, and I'm good, you know, going to the room with him and watching him set everything up. And they had a bed and everything for me. So for the 4 weeks that he was in the NICU, I was there every single day. I slept there every single day. Like, I got the blessing to do that. And I just thank God for the opportunity, because, you know, like, it doesn't happen that way for, you know, for everyone. While I was there, it was so many babies who I would see their moms come after work, or their moms had other children that they had to stay home and take care of before they get into the hospital. You know, you just have life. And I know how hard it can be, especially now being a mom. So no shame to any mom whose baby's in the NICU and you can't be there all day. Because now that's my fear with this baby. What in the world? That's my fear with this baby, is I'm praying that there's no NICU. You know, they went over my chances again with everything. And this time I'm not getting beside myself, because I've already gone through it. So I know what can happen. It can be worse this time. But I'm just praying, and I'm going to try to do some things different that can hopefully either prevent preeclampsia, or if it comes later, that there's no NICU time. My OB said even if I have him at 35 weeks, which is 2 weeks later than I had my son, that time alone can decrease his chances of not being in the NICU at all, because I have a 2-year-old at home and he sleeps with his mommy every night. So, not saying he can't do it, but I know my baby's going to need me, and this baby's going to need me, and I, you know, going to have to figure out how to work this out. And I may not be so blessed or lucky this time to this baby to go into its own private, you know, NICU room where I can be. He or she, don't know what I'm having yet, may be in a regular NICU room, depending on how early he or she is born, praying there's no health problems. You know, that they don't, because, you know, if they come before 30 weeks, that's when they have oxygen and all this other stuff that they need, and they have to be on the medical side of the NICU. And I wouldn't be able to spend a night, you know, and I will come home to my baby gladly, but am I going to sleep and rest having a baby in the NICU? I don't know. So that I'm trying not to think about. So I've been all over the place, y'all. I'm so sorry, because I was starting off trying to say this baby was not planned. I was one and done. I don't even know how and when I got pregnant, and I'm not over exaggerating. Don't know how this happened. I was still breastfeeding. Yes, I was still breastfeeding. Breastfeeding, as well as on a birth control. The birth control I was on, though, I will say it wasn't the double hormone. It was the one hormone, because I was breastfeeding. That was the one that was breastfeeding safe. But I called in December to get switched, because I didn't want any mistakes, because I had been on it for so long, and I had already found out that what can happen after a while. And the nurse, when I called, told me when I came for my yearly in April, we could switch, but I would have to be completely done with breastfeeding. I told her that he was beginning to wean off, but he wasn't completely done. She said any other pill cannot be in his system. I thought I was trying to be slick and was going to use that pill to dry up my milk, so there was no weaning process. My milk is dry and he off me. That was the plan. But she told me, no, it's not that simple. He cannot consume a birth control pill. So she said he has to be completely done. By that time, we were off a daytime feeds, but he was still nursing to go to sleep. So she was like, no. So she was like, by the time you come in April, have him off, and we'll be glad to switch you. Or she said, even if you get him off before you come, she said, you don't even have to come in. We'll just let us know he's completely weaned off, and we'll switch you. But I'm glad she mentioned baby safe, because I was about to lie and say, oh, he's not breastfeeding anymore. He's off. I was going to call and make something up in the next 2 or 3 or 4 weeks. But once she said it wasn't baby safe for him to be on it, that's when I said, okay, well, let me get him weaned off. And I started the weaning process to get more serious with it. And I don't know if that has something to do with it. But yeah, I got pregnant. When I had just started back working out that December, that October, I'm sorry, October of 23. I had just started back working out. I was trying to get back to myself. I was seeing changes. My nephrologist even made a comment on, how good I was looking already. I'm not somebody who's athletic, but I tend to work out, so my body has a muscle memory. And I'm not trying to make it seem like I'm this fine, fit person. I'm not, but I do, work out. So I was starting to, I guess frame out my muscles were beginning to build. I mean, even I was working out with my cousin, and she was making comments about how she was seeing changes in me already. So I was feeling good, feeling good, getting back to myself, starting to do things that I hadn't done in a long time, having a toddler since having my baby, period. And I was making all these plans for what I was about to do. So Lord, don't get me started. So many plans with school, with working, with quitting, with business, with moving out of this, not only this state or this city, but even possibly this country. I had plans. And yeah, so like, if you're in my circle, I was planning some stuff. But getting fine was one of them. Me being that fine mama with my one baby, that was number one on that list. So yeah, got pregnant, found out, couldn't believe it, didn't even think, when I wasn't feeling well, I didn't even think I was pregnant, because like I said, that was nowhere near in my mind a possibility. But me working out, I noticed that stuff was start to span back out. So I'm thinking, oh, well, let's just get a little bit more stricter on your diet, or how you're the meals you're eating. And I'm like, whatever. But yeah, I just told my cousin, like, my midsection is just like, I don't know what's going on. So yeah, I was pregnant. Found out I was pregnant, wasn't happy. I literally kept saying how, when, how. Like, I said it over and over again, like, how and when, how and when. I had to ask God for forgiveness. And if you watch this, I will mention God. I'm a strong believer, and I've always been a believer, but the things that have happened over my life in the past 4 years has really, really, really brought me closer to my journey with God and my faith. So that's going to come up a lot, especially if I continue this. You will hear me. You will hear me talk about God a lot. So I'm not apologetic about it, but I will say, if that's not your thing, then So anyway, I had to ask God for forgiveness, because I was so angry that I was pregnant when I first found out. When I saw the ultrasound, about a week later, the anger kind of went away, but I'm not going to act like I was one of those people where it's like, oh my God, I'm not angry anymore. No, the anger kind of went to me saying, okay, I can't believe this. Like, I still was like, I can't believe this. I wasn't angry, but I was saying, I can't believe this. Hold on. Okay, never mind. So then after that, time went on, and things just got better. So yeah, then by the second ultrasound, I was just like, dang, it's really a baby in there. Like, at this point, I'm just still in the shock phase. I done asked God for forgiveness, but I ain't never got excited. I'm just like, okay, this is my new life. I got to adjust. It doesn't mean my plans are going to stop. It just means now I have two babies with this plan. It may be a little harder, and I may take longer to get there, but God has a plan for me. I still, at this point right now, I will not say I'm excited, but I am at a point where I'm at peace, and I'm ready, and I'm thankful for the opportunity, because to go from not knowing about one baby to now having two, and everything is negative from what they can see with my blood work and the scans as far as birth defects and chromosome abnormality, I will say I am blessed, and I am thankful, and God has a bigger and better plan for me than I have for myself. And because I have learned to trust him so much, I don't even care. I know everything is going to be okay. So for this is where I am now with this pregnancy. So the reason why I wanted to block this pregnancy, I wanted to block my first son pregnancy, but like I said, I let fear and anxiety, and sorry, I'm talking fast, but I got to hurry up. I let fear and anxiety scare me. The reason why I decided to do it this time is because I had the incident with preeclampsia. And if I can help anybody who has lupus, have had a transplant, or have both like me, I'm going to see if maybe this helps. So I have been reading and researching on ways to either decrease your chances of getting preeclampsia despite the odds, or where it comes later on in your pregnancy. Like I said, because I had it with my son, my doctors already told me not only do they think it's going to come back again, but it may come back sooner. But what we're trying is the baby aspirin at 12 weeks. I'm sure you know about that. Fish oil pills. And I'm doing some personal stuff outside of the doctor, because my boyfriend and we try to do like little health juices or whatever. We have a local herbal place here that we visit, so we're trying different stuff like beet juice, ginger, fresh juices. I will get more information on that as time go on. I don't want to just throw words out there. And then working out, the way I haven't worked out. I started working out last week, but I hadn't worked out my whole pregnancy because I've been feeling like crap. With my first son, I never felt bad. This pregnancy, I feel like crap. So I'm starting to feel better now. So I started working out last week. Then plus my therapist, I see a therapist, brought it to my attention that maybe if I start working out, I will start feeling better. So that's what made me start working out last week too. As well as I want to see, because that's one thing I read, working out at least 3 times a week for at least a hour, or working out every day, even if it's for 20 minutes, can decrease your chances by 30%. But keep in mind, that's for a normal person. I am now lupus transplant and over the age of 35. Oh my God, I can't believe I'm saying that. So that's 3 odds against me right now. Oh, and I've already had preeclampsia before, so that increases. So I have 4 things against me that pretty much guarantees preeclampsia. So I'm going to try these things, see if they work. I don't know if I'm going to record myself juicing. Don't know if I'm going to record myself at the gym. I may. Don't know if I'm going to record myself taking my pills. I don't know. I'm not really a content person, but who knows where this will go. But I will log a journal. I will update. I will see how it's going. And if I can make it prayerfully throughout this pregnancy without getting preeclampsia, or at least until 35 weeks. I'm honestly praying for 37, but my doctor is saying 35. But if I can make it to 37 weeks without any preeclampsia, then I'm not saying this is what worked, but I'm going to say this is what I did differently that I did not do in my first pregnancy. And this is what could help anyone else with lupus or a transplant, or who's 35 and older, prevent from having preeclampsia. So here we are. I'm going to post this video. I'm not sure when, but I'm going to post it. I said a lot. I was all over the place. I'm sure I didn't hit any topics. So when I post it, if one person see it, or 2 people see it, or 20 people see it, I don't know. If it helps one person, that's enough. Because like I said, it kept coming to me. I'm a believer in God. So when stuff like that happens, I believe God's putting it on my heart to just do it. And we all have fears. And I've been so scared. And I had to realize I'm talking to a camera, Marjorie. This camera will eventually talk to people, but I'm not talking to people live. So that kind of helped me too. So I'm talking to I did not mean to say my name. Anyway, I'm talking to a camera. And yeah. So if I post it, you guys will see it. It'll be on my YouTube channel. Message me for any questions. And if no one sees it, it'll just be out there, but at least I can say I did it. Something I was scared of. I did it.